Today, forces of disruption and transformation are converging. Too often, we are offered false choices: health or security, livelihoods or lives, solidarity or sovereignty. We reject these trade-offs.
And now I wish to invite the Regional Director for WHO Afro, Dr. Mohamed Janabi, to make his remarks.
Your Excellency, Dr. William Samoei Ruto, President of the Republic of Kenya, Cabinet Secretary, Minister of Health, Honorable Aden Duale, Dr. Suleiman Shababuddin, President and Vice Chancellor of the Aga Khan University, Professor Axel Price, President of the World Health Summit, Dr. Jen Kaseya, Director General of Africa CDC, Madam Zainab Hawa Bangura, DG of the UN offices in Nairobi, Honorable Ministers, distinguished guests, partners, colleagues, good morning. Hamjambo. Your Excellency, allow me first to congratulate you and the people of Kenya on a moment that inspired the world. Yesterday in London, Kenyan Sebastian Sawa Your Excellency, Sebastian Saya sounds like a name from Tanzania, but he made history, winning the London Marathon and becoming the first man ever to run official marathon in under 2 hours. Let me be more precise. He ran 1 hour, 59 minutes, and 30 seconds. It was more than a sporting triumph. It was a reminder of what discipline, resilience, and belief can achieve when preparation meets purpose and when the impossible becomes possible. That lesson could not be more relevant for us today. The WHO African region is honored to co-convene this first ever World Health Summit regional meeting. This is a historic moment, not simply because we gather here in Nairobi, but because the decisions we take now will determine how resilient our world will be in years ahead of us. Today, forces of disruption and transformation are converging. Too often, we are offered false choices: health or security, livelihoods or lives, solidarity or sovereignty. We reject these trade-offs because there is no prosperity without health and no security without a resilient health system. Investment in health is not a charity. It is insurance for our shared future. And that investment is not measured only in US dollars or sterling pounds, but in trust, in knowledge, in systems, in people, and in innovation. Our world is profoundly interconnected. A failure in one place can send shockwaves everywhere, and we saw it during COVID. Borders will not stop it. Distance will not delay it. The timing may differ. The intensity may vary, but in the end, we rise together and we fall together. As an African proverb reminds us, if you want to go fast, go alone. if you want to go far, go together. That wisdom speaks directly to this moment. Pandemic preparedness begins with strong primary health care. Digital innovation and artificial intelligence expand access and strengthen delivery. Climate resilience is inseparable from health security. Gender equity and youth leadership ensure progress is inclusive and lasting. Beneath everything we discussed this week lie two fundamental questions. How do we make systems work? And how do we finance them sustainably? Let me share three guiding principles for our discussions: planning, prioritization, and partnership. First, with planning. Systems do not align by accident. Funding does not appear on its own, and silos do not dismantle themselves. That is why WHO supports countries to adopt a one plan, a one budget, and one report. A single government-led, data-driven national health strategies. One financing framework, one result systems, and everyone aligned. This is how we move from fragmentation to efficiency, from duplication to impact. We cannot do everything, but some things, really, they are not optional. Primary health care must come first, our most cost-effective investment for prevention, chronic care, maternal and child health, and outbreak response. Alongside, we planned local manufacturing. Very well-planned local manufacturing, I have to understand. Pandemic preparedness and climate-resilient infrastructure. We must meet the urgent needs of today without borrowing vulnerability from tomorrow. Finally, partnership for financing, starting at home by working differently with Ministry of Finance, strengthening public finance and expanding physical space for health. Engaging the private sector through blended finance and impact investment, aligning financial returns with social value, and deepening regional and global cooperation through new platforms, financing hubs, and trade frameworks. If some old doors have been closed, we build new ones. At its heart, health is a moral responsibility to protect life and dignity, and if we act as a good steward of what we have, stand in solidarity with one another, and lead with courage, starting here in Nairobi, Africa is not waiting for permission. Africa is ready to lead, and WHO is here with you. Asanteni sana, thank you.